Morales, it's good to see you today.
Thank you.
The last time in your initial session, you recall I explained all the confidentiality policies and we got all that squared away. Do you have any questions since the first meeting?
No, I don't think I do.
Okay, can you share with me how things have went since our last meeting, which was just last week, our first initial assessment?
Things have not been well. I'm still experiencing panic attacks, and these usually just occur out of nowhere. I get so afraid that sometimes I still feel the urge to go to the hospital.
I know this must frighten you very much.
Yes, yes, it does. I just don't understand why I keep having these panic attacks. And I continue to have these problems with just going out and just driving a few miles from our home. That really causes anxiety. I feel so bad that I cannot just stop having these anxious thoughts and I can't get my life back again.
It seems as though you're still questioning what exactly is causing your anxiety and fears. And I'm not sure exactly what's causing your specific anxiety and fears, but I do know that you should not feel bad or blame yourself in any way for experiencing these anxious thoughts. I know we had previously discussed as one of your interventions that you would receive some pamphlets on anxiety and the causes of anxiety. And I will ensure that you will get that information today so that you can review and possibly kind of review that for homework assignment before you come back next week. It's important that you have that information so that you can see that you're not alone.
I think that would help, and maybe I can have a better sense of what's going on. I also continue to worry about what my family and my friends think, and about what they just really think about me maybe coming to counseling.
What are your fears regarding counseling?
I just get embarrassed that I have to come to counseling. I'm also afraid that maybe my significant other might not want to be with me and end our relationship just because I'm coming to counseling. If they did that, I just could not bear the thoughts of losing me.
I understand there's a lot of stigmas around anxiety and seeking help, and it's understandable that you're concerned how your family and significant other will react to your treatment. I understand that you're originally from Spain, and when you were a small child, you moved to Puerto Rico until you lived there until you were in your 20s, and then you moved here. Would you like to share a little bit about your background and your journey and your culture?
Yes, all that is correct. When I moved here, I didn't really have a hard time adjusting. Before I moved here, I had experienced my first panic attacks. My parents believed I was being controlled by evil spirits, and they encouraged me to see a spiritual healer.
Okay, can you help me understand just a little bit better about your parents wanting you to see the spiritual healer?
Yes, seeing a spiritual healer is important in our spiritual community to help us rid ourselves of any unclean spirits from our bodies.
Okay, so it appears your parents felt that you had more of a physical problem. You needed to be healed just from this physical problem.
Yes, that's right. But I did not pursue this really any further.
Mm-hmm.
I feel my parents, however, at this time are okay with me seeking counseling with you. And as far as my family goes, my mother was extremely anxious and became even more protective of me after I was diagnosed with a seizure disorder early when I was young.
Okay, so your mom's anxiety level increased, and she felt the need to be overprotective of you when you were growing up a lot.
Yes, yes.
That had to be extremely hard and difficult for you growing up, and it didn't leave much room for you to have much freedom.
No, it didn't. My parents and I have always had a close relationship, but they did not want me to relocate here. But despite going against my parents' wishes and relocating here, I feel I have done well professionally. I enjoy my job, and I'm even up for a promotion.
You've accomplished so much. I know your parents are proud of you. I think you're going to benefit from counseling, and I know we can do this together to help you achieve your goals. In our initial meeting, we discussed what's called cognitive behavioral therapy to reframe some of your thoughts around anxiety, especially your panic attacks. You've been keeping a journal over the last week of any triggers that may be causing your panic attacks. Can we look at your journal?
Yes, I have it with me today.
Can you please share a little about the triggers that you've experienced over the last week?
Well, I did seem to be a little more aware of certain activities, such as getting in my car, that causes me to have, more anxiety. And definitely driving far from my home really makes me nervous.
I know that's got to be scary. What do you think of the idea, after we review your journal, we start working on the cognitive behavioral therapy today?
That sounds all right.
We also can look at the Beck Anxiety Inventory, and that's just a instrument that we use to measure your anxiety level. And what that's called is we get your score today, and then maybe in the next 2 or 3 sessions afterward, we'll take the anxiety test again to see where your score is, see if your anxieties came down. Does that sound all right with you?
Yes, it does. Thank you.